Hello class, and welcome to Module 4. During this module, we will be talking about two main topics, pediatric pain and pediatric pharmacology, or how you give medications to children. So starting off talking about pediatric pain, there's lots of things that we need to consider when we're thinking about children during painful procedures. Number one is how we prepare them for these painful procedures. It gets tricky. With different age groups, we have to treat them differently. How long before the procedure we will be communicating with them, how we will be talking with them about the procedure, what kind of words that we use in communicating with kids all make such a big difference. For example, even as something as simple as coming in to get vaccines, we want to prepare the child for this. And again, depending on the age of the child and the developmental level of the child, we need to think about how we're communicating with them or how we're telling them. We don't want to tell them, well, you're due for 2 shots today, because the word shot may mean something very different to someone depending on their background than another child who knows what a shot means. So we don't want to even go there. But we may want to say something like, we're going to put some special medicine in this little tube, the syringe, and it'll feel like a little pinch, and then it'll be over, and then you want to say something that's going to be fun afterwards. Something like, and then we'll get you some stickers, and mom's going to take you to the library. Something like that, so they know what to expect, that it's not going to last forever. Remember, a lot of them don't remember the last time they had vaccines, or this is the first time, or they aren't sure what to expect. So we want to prepare them for this. Also preparing them for more difficult things like surgeries. We bring them into the hospital ahead of time, talk to them, let them play. Play is huge. That's a huge Peds up point. Play, play, play. They play with different medical equipment. We can show them the procedure on a doll. See, this is where the procedure is going to be done. All talking to them in a way that they can understand. When children are going through painful procedures, like getting vaccinations or having an IV placed, we let them cry, we let them scream. Remember, they have no control over this situation. We are telling them that this needs to be done in order for them to get healthy. So we don't want to tell them that they can't cry. We never want to do that. Let them cry and scream as much as they can, as much as they want. When children are in pain, remember that many times they're not able to verbalize their pain. So, for example, a child is in the hospital and they've had a surgical procedure. They're going to be in pain. So how we assess them for pain? Does the nurse walk in and say, so on a scale from 1 to 10, how would you rate your pain? They're not able to do that. So we have different methods of assessing children's pain. We have the FACES scale. So it goes from really, really frowny face to really, really happy face. And on those scales, the child can just pick out which face they feel like they are feeling at that moment. Also, we can look at their physiologic signs. Their heart rate may go up, their blood pressure may go up, their respiration rate may go up. So there's other ways, even in infancy, that a nurse can assess a child's pain. And then secondly, the other topic we're talking about is giving medications to children. Now, once again, the theme for the course is these are not just little adults. So you can't just hand them a cup of 10 pills and say, take your medicine, please. We need to be very creative when pediatrics. So we can, for instance, have the child, if they have a medication in an oral syringe, we can say to a preschooler, would you like to squirt the medicine in your mouth? And they just love that. So that's a good trick. Making the medication taste yummy, like in a bubblegum medicine, like amoxicillin. Kids sometimes will take their medicine so readily, they'll ask for the bubblegum medicine. So there are different tricks that we can use to get children to take the medications. Before you administer the medications, you do want to make sure that the medications are dosed appropriately. So always, always, always double checking and making sure that the provider has ordered the correct safe dose. You can look this up. Most times it is ordered in by weight. So you will do calculations, milligrams per kilograms most oftenly. So you want to get really good at your math skills. You will have math on your exams. And NCLEX will too, so you want to make sure that it's not hard math. So I would say do mental math first. You want to get your conversions down, right? Milligrams to grams and kilograms to pounds, because we will many times be given the weight in pounds, but we need to convert that to kilograms before we can calculate the correct safe dose range for the medication. And then lastly, one more thing in pediatric pharmacology, medications work differently in pediatric patients. So all those pharmacokinetics that you learned about in pharm, absorption, distribution, metabolism, and excretion may work differently in a pediatric client. So you want to be aware of these differences when you're giving medications. They can have different adverse effects. So that's it. Have a great week. Take care. Bye-bye.